ahead.
Hello, I'm Dr. Drew Luce of Dulles South Veterinary Center in Chantilly, Virginia, and I'm here with Kimberly Jehoda, one of our veterinary assistants, and Phoebe Luce, my 3-year-old Dobie. Since November's Cancer Awareness Month, we thought we would probably show you what to look for in your pet in regards to lumps, bumps, and growths, and specifically, how do you determine what would be concerning, and how do we as veterinarians typically approach lumps, bumps, and growths on your pet. I figured we would start with an examination first and kind of walk you through how we would typically look at an animal and what we would use as a determination secondarily as to would a lump or growth be concerning to us. What types of things do we utilize to determine that? Lastly, I thought we could probably go through a brief understanding of what do we do in the veterinary hospital to determine is something need to be removed versus can it be approached conservatively, monitored at home. One of the things that we typically look at with dogs specifically is breed of the animal. Breed of the animal, or what we call signalment, which includes age, breed, and sex, and whether or not they're intact or not, meaning have they been spayed or neutered. All these things are very important when it comes to predilection for certain types of malignancies or growths. Typically on examination, I think one of the things that's really important at home for an owner is to on a regular basis to feel your animal. It sounds ridiculous, but having hands on your animal so that you know what they feel like, and specifically when you have this much skin, and Phoebe here has a short coat, but a lot of animals have a lot longer coats, and so finding growths can be more difficult. And so knowing what your animal feels like, whether it's up here around the head and neck, underneath the chin, these are important areas because we have lymph nodes up here, and so we look at these areas. We look fronts of the shoulders, also where there's lymph nodes, and underneath the armpits. These are areas that should be felt on a regular basis with your animal. And then secondarily, just through routine petting, which obviously Phoebe doesn't like, is having an idea, is there anything unusual underneath the skin? Has anything changed? Is there a difference in contour? Do we have any discharge from our nose that we typically wouldn't have? We look at all avenues when it comes to animals because they don't talk to us. And so little things can be very important as the key. With lumps, bumps, and growths on your pet, really the thing I want to emphasize is early detection with diagnosis and treatment is the key. A lot of times, same respect it is in people. And so paying attention and getting advice early on is really important. The other thing that I commonly see in animals is on a routine basis is Phoebe is laying down here. If we switch her belly over or have her stand up, if you'll move your arm for just a sec, Kimberly. One of the things we look at very frequently, which owners would never typically think of, is their abdomen and how their abdomen looks. Phoebe has a nice sunken in appearance to her abdomen because she's a deep-chested dog, but most dogs actually have this appearance when they're in good shape. The importance of having your animal in good body condition can't be overemphasized, because when this area carries a lot of body weight, it becomes a lot more difficult to tell if there are changes. If she had something going on within her abdomen, a lump or a growth, I would see a change in contour on her belly. And that becomes particularly important when she lays down on the ground, because when she lays down, it pushes on the abdomen, and so things become exaggerated on the other side. So I always tell owners, pay attention to this area and how it normally looks. And if you start to see a change in contour, especially behind the rib cage, get that looked at by your veterinarian. That's super important. The other areas that are really important are back here in the back of the hind legs, where we have little lymph nodes in here, and they feel anywhere from little pea size all the way up to grapes, depending on the size of the animal. Cancers that spread via the lymphatic system, first thing we typically notice is lymph node enlargement. Most of the time we don't see animals until owners have noticed that they're lethargic, they're not interested in eating, And when we see them, their lymph nodes are huge. And so those are things that could easily be picked up on by owners early on. Early change in lymph node size or a lump underneath the skin, that's something that should be looked at. And then obviously the typical things, looking at just the skin underneath the belly, the inside of the legs, looking for any growths or unusual things off the surface of the skin. The other area that I typically look at is eyelids, and Phoebe's a good one because she's black against white, and so it makes it very easy to see. But looking at the edges of the eyelids for any growths that occur off there, and sometimes growths occur off the inside of the eyelids, and so unless you're looking for them, they would go unnoticed until they're big enough to be seen. So when it comes to growth, what do we look for? Things that are really important that we look at: size of the growth, rate of growth of a particular lump, appearance of it. Is it red? Is it normal skin color? Is it very darkly pigmented? And then behavior of the growth. Is it angry on the surface? Does it appear inflamed? Those would be things that would be more concerning. Typically, with malignancies, we commonly see irritation or evidence that they're very angry. Those things should necessitate a call quickly, as opposed to a very small growth hanging off the skin that's normal skin color, which typically that would indicate it would be more likely to be a benign growth. When we see growths on an animal, if Phoebe had a growth here on her skin, for instance, I would want to look at a couple things besides what we just discussed. I'd be looking at, is this growth freely movable or not? If we have a growth on the skin or underneath the skin and down alongside of the chest is a common area, if this growth I can freely move around, that would indicate typically less likely to be malignant than something where I grab a hold of it and I can't move it, meaning it's attached to the underlying tissue. Those are typically more concerning. And so when we see these types of things, we utilize all those different techniques to determine how should we approach it. At the end of the day, what we try to determine is this something that should just be monitored? Is it something that we should have pursued via what we call fine needle aspirate or FNA? Or is it something that should be approached aggressively, meaning remove it and have it biopsied right away? All those things, size, location, rate of growth, the appearance, all those are important in determining that. Ultimately, with growths, when they're underneath the skin, the fine needle aspirates become very important for us, and that we will essentially pass a needle into a growth and we're popping it in different directions, trying to get us a representative sample of cells. That has pros and cons to it. One is, commonly you can get a diagnosis, and with certain types of malignancies it's very easy to get a diagnosis with a fine needle aspirate, and it's not very invasive, so we don't have to do surgery on your animal. The disadvantage is sometimes, and you can picture in 3 dimensions, if you're poking a round circle, you can miss important cells within that circle, and so sometimes fine needle aspirates can be wrong, or they can miss important cells. It's just a technique that we use. Ultimately, if a growth is enlarging in size, particularly if it's enlarging in size at a rapid rate, it may be best just to have it removed. And in some cases, removal with biopsy is much more diagnostic than a fine needle aspirate would be. And it allows us to grade masses. Grading of masses determines how aggressive they are a lot of times in the treatment that would be recommended. So in a nutshell, hopefully this gives you an idea of things that you should be looking for with your pet, and keeping in mind that the things that are really important are early detection of lumps, where to look, the lymph nodes underneath the chin, the front of the shoulders, feeling your animal and knowing what its skin and underneath its skin feels like, and if you find a lump, how is it behaving? Get advice soon, early on, rather than waiting. That's the key. And get advice from your veterinarian as to whether you should have fine needle aspirates done, whether something can wait and just be monitored at home for changes in size, or whether it's something that should be removed and biopsied.